Apparently, there's a lot of Bear Grylls fans out there. You've asked me to watch the scenes, comment on their medical accuracy and safety, and I'm about to do that.
You'll need water, but if there isn't any, you can drink your own pee.
No! Bear, come on. PSA, do not drink your own pee. If you drink what your body excreted, especially if you're already borderline dehydrated, you're gonna be getting rid of all the stuff that you don't need and then taking it back in. I know we sometimes say urine is sterile, it's not. There's bacteria, then you're gonna be drinking it. Now you're giving yourself diarrhea, potentially another fever-causing illness, which is gonna dehydrate you further. And there's other uses for your pee. Put it on your clothes and put it on your skin so that when it evaporates, it cools you down. Might not smell great, but you'll survive. Come on, Bear.
And if I just peed on the ground, that's all those fluids wasted.
They're not wasted because fluid management within your body is not just fluids. It's fluids plus minus electrolytes. And what your body does in urine is it gets rid of those electrolytes that it doesn't need, and it keeps a very careful balance. When you drink your urine, you're essentially throwing that off further and further each time. So like, no, do not drink urine. I'm gonna eat some Thrive seaweed while he drinks that urine. Also salty. Much tastier.
Not my favorite.
No? That's not the Gatorade flavor you go for?
Urine is actually 95% water, and it's sterile when fresh.
It's not, because it has to go through your pee hole, which sometimes has bacteria in it.
And drink it sooner rather than later, as it's a breeding ground for bacteria.
How does Bear Grylls say that his urine is sterile, meaning it has no bacteria, and then say it's a breeding ground for bacteria? Where does the bacteria come from?
One thing you can do if you're stuck out here with no water source at all
Is not to drink your own urine.
is actually drink the fluid from a fresh elephant dung.
Oh my God, does he just try and find liquid anywhere he can?
Pretty disgusting.
Yeah,
but
it is.
could save your life.
It's not, all of this is so temporary, it's incredible. There is so much bacteria in that water that we will give you diarrhea, thereby dehydrate you. This makes no sense.
Wow, I'll tell you what, these are the biggest grubs I've ever seen, look. And this is just the sort of place that they like. They feed off all this rotting, soft interior of the palm tree.
Just think about that. Do you want to eat a bug that was just eating the rotten interior of a palm tree?
And actually the locals eat a lot of these. They're like a delicacy. They're full of good protein.
When he says good protein, does he mean it?
It'll be worth every one of its 140 calories.
Cook it, my guy.
Holy smoke. That is just horrible.
Yeah.
And you know what? They can keep their delicacies.
Like, I've seen people eat insects and crickets and stuff before, and they do have protein, but like the cooking part is just mandatory. Is that
What
camel?
I'm looking for is the stomach.
How does he know the
itself
anatomy of
It's in
animals?
3 parts, so it can separate the liquids from the solids.
Wow.
And the bit I want is called the rumen.
I see the fascia there.
Fluids.
This rumen water is just like a reservoir.
What? Oh my God. I can't imagine that that is safe to drink.
And a nomad told me once how his uncle in the 1950s was lost in a sandstorm out here. And he actually ended up killing his camel to get at the rumen and all this fluid inside. And that actually saved his life.
As an evidence-based physician, I don't like hearing anecdotes like that some guy one time 200 years ago saved his life by killing his camel. That like proves nothing to me. That story could have been made up. It could have been embellished. It doesn't mean that everyone should be killing camels and drinking their rumen water. I don't know, it sounds so extreme.
And look inside, you can see everything that's been eating.
Which is what?
That's just
Grass?
sort of partially digested. And the fluid in this, again, is...
No, he's gonna drink the gastric juices of a camel? No, come on. Oh my God. Bear Grylls the type of guy 5 million years ago to see a cow udder and just see fluid and just start sucking on it.
You can eat these things straight out of the river like that.
Oh my God, why does he, it's like he does it on purpose.
Just what my body needs to keep moving. I'm gonna take full advantage of this feast.
It's kind of weird to me that as a survival specialist, he makes no use of fire here. Fire was invented for a reason, to cook things to prevent infections. Because one of the leading killers before fire, before the use of cooking our food, storing our food correctly, was diarrhea. It would dehydrate you, electrolyte imbalance, your heart would stop, acute kidney failure.
I've noticed a lot of bees in the area, so I'm heading through the scrub to get to the hive and find some honey.
You know I'm a honey fan. Like, I love honey. Honey works as good or better than over-the-counter cough suppressants in the pediatric population. Oh, that looks fresh. Fresh honeycomb.
Leaving my forehead exposed was a real oversight.
If you get a really bad sting and you happen to be an individual who is severely allergic to a bee sting, you go into anaphylactic shock where your throat closes up, your blood pressure drops. That could be lethal very, very quickly. That's why if you know you have an allergy, you should have an EpiPen like that on hand at all times. Not necessarily an EpiPen, any kind of epinephrine autoinjector. Oh, he's swelling.
It's made all of, this part of me swell up.
Allergic reaction.
That's serious edema right there.
Fatal. I'm worried about anaphylactic shock. The first signs are swelling around the eyes, followed by difficulty breathing and loss of consciousness.
These type of large reactions are really treated with supportive care if it's not true anaphylactic shock. You want to think cold compresses, steroids in serious cases, and really just making sure that the patient's airway is not compromised, their blood pressure remains stable. Once that's okay, that usually does pass in a few days, but swelling on its own, if it's not over the airway, is not intrinsically dangerous.
I'm on a raft in the Pacific Ocean. I've collected some fresh water, but it's full of bird droppings and it's rancid. Drink this and you'd probably vomit and risk worsening dehydration. But there is a way of using it to gain life-giving fluids, but only as a last resort.
I don't even know what he's about to do, but the fact that it has bird droppings makes me think that there's so much E. coli in it that if it makes any contact with the inside of your body, whether it's through a cut or you drinking it, you're just gonna get a massive infection. And a massive infection when you're stranded and you're surviving is like the worst case scenario.
I'm gonna give myself an enema.
Oh my God! He doesn't try and survive. He's gotta think, what is the most ridiculous extreme thing I can do in order to make this show? Could you absorb fluids from your rectum? Yes, there are small blood vessels there. We do give suppositories there, so there are absorptive qualities there. Oh my God, I can't believe I'm even thinking about this. There's also a lot of bacteria that lives in your rectum, including E. coli, which doesn't enter your bloodstream. So it could be an okay place to have some bacteria. There's just so much that could go wrong. I think it's like a 50-50 shot. Will you survive or will you kill yourself further?
No, that's placenta.
Oh my God.
Somebody had a baby.
Is that Shaq?
What's rare though is find it so fresh. That for me is good news.
Is it good news?
It looks actually like dinner.
Shaq, don't do it, buddy. I've seen you three-peat.
And this is a first for me to eat placenta.
Yeah, it should be a last. Like, there are some cultures that do this because the placenta is like, it has the nutrients and it does the oxygen distribution for the baby through the umbilical cord. And there's some cultures that think about doing this, but like the CDC has put out a specific warning, like, do not do this. Like, if you get a group B strep infection in your placenta and then you eat it and then you pass it to your baby through like breast milk, that's deadly. That's lethal to a newborn. I give him props. I wouldn't do it. Shaq is my man.
It's traditional for Berber men to eat goat's testicles. They're thought to enhance fertility, and it's certainly gonna be a test of my manhood.
Look, I'm respectful of all cultures. The line I draw is medical misinformation. If you're gonna tell me eating a goat's nut is gonna help you get fertile, I'm not gonna buy it. I need evidence-based medicine for that. Why raw? Just put it over a flame.
Well, that's definitely a first for me.
See, he's throwing up because there's bacteria and it's gross.
And what this stuff is like sunblock.
Oh, wow.
And the coral itself will use this at low tide, where it's exposed to the sun. It will secrete this as a way of protecting itself. Just amazing.
Wow.
Scientists have actually reckoned this stuff is like as good as factor 50.
Wow. And SPF 50 is pretty great protection. I mean, like I always say, get the highest SPF possible, even though like once you get above 50, not much is changing. But that's only if you're following the exact guidelines. And I don't know about this whole mushroom thing, but like just get the one from the store.
If it's got tentacles like that, those are stingers. But
So you can't eat it,
Jellyfish scare
you
me.
need like the body of it,
right?
boil it up. I mean, it's a bit like tastes a bit like gelatine, but it's pure protein.
I don't know what the deal is with eating jellyfish. I missed that day in residency and in medical school. Folks, today we're learning about eating jellyfish. It's like peanut butter and jelly, but with fish.
But those are ow!
It got you?
Yeah, papa.
So he got stung by a jellyfish.
Oh, and he put it in his mouth?
Movies before where if somebody gets stung by a jellyfish, you have to pee on them.
The whole thing with peeing on a jellyfish thing really comes from preventing like the discharge of more toxin and creating more inflammation. The general consensus has been to use seawater and not to use fresh water, especially, because it can cause more of that toxin to be released.
If you just relax, then I'll relax. Now I've got stage fright.
I can't relax.
To pee on demand when somebody's in pain is very difficult.
Peeing is actually a complex neurologic process. It's very easy to throw that off. If, for example, you've had a stroke, if you had an injury to that area, it's very easy to develop urinary incontinence or urinary retention. And sometimes the treatment for that is actually like biofeedback and understanding how to control different muscles in the area.
I've been in water this cold before.
Oh, he's going swimming in cold water.
Playing horrible.
Yeah, it's horrible just getting undressed.
Chili Perkins. Okay, well, I'm hooked up to this transmitter as well. And that's just showing my heart rate, but also my breathing rate.
Generally what happens is when you hit really cold temperatures like that or go underwater, a lot of times you'll have this like diving reflex where your body will automatically send you into a bradycardic rhythm where the electrical activity of your heart actually slows down to allow you to survive longer underwater. We actually used to use this type of treatment for supraventricular tachycardia where we actually got patients to perform this diving reflex vagal maneuver and it would reset their heart rhythm, slow it down. Obviously it needs to be very carefully monitored. And now with the new medications we have on board, we generally don't have to do this. Oh, I'm cold for him. I'm cold for him.
Watch as my heart rate drops from 160 beats per minute to 55.
Yep, diving
Known as
reflex.
a mammalian dive reflex. It gives you vital extra seconds to make it to the surface.
He did it! See, it worked. His survival mechanism kicked in. We actually also use hypothermia treatment in patients who are undergoing prolonged cardiac arrest, where we realized that if we put them through a hypothermia protocol, very controlled, we actually decrease the oxygen demand on the body on certain organs. Therefore, we give them a little bit longer survival time. Bear Grylls certainly does a lot of cool stuff on the ground, but I just flew an F-16 in the sky. Here's what happens to your body when you're flying in an F-16 and experiencing a lot of G's. Click here to check that out. As always, stay happy and healthy.